Hello. Hello. Good morning.
Yes, ma'am.
Am I audible?
Yes, ma'am.
Okay. What yesterday I have posed you the certain PPTs of susceptibility. Have you seen it? All the students? Have you seen that pictures of susceptibility?
Yes, ma'am.
Only one student have seen.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
समझा उसमें से? समझा कि नहीं? अरे हाँ या ना? अगर आपने वो पीपीटी देखे हैं तो आपको समझा क्या? Say yes or no. Namrata,
Yes, ma'am.
have you seen that PPTs?
Yes, ma'am.
समझे वो?
येस मॅम पण ते लॉ ऑफ ससेप्टिबिलिटी आहे
नाही ते
ना.
व्हायचंय आपलं अजून.
अच्छा ठीक आहे, मग समजलं.
सौम्या,
यस मैम।
समझे आपको वो पीपीटीज जो मैंने कल भेजे थे?
यस मैम।
ऋतुजा फिरके, ऋतुजा शेटे.
येस मॅम समजलं.
ओके. सोमेश,
येस मैम समझा।
सोमेश, okay. So what is susceptibility that we have seen? It is a reaction towards the stimuli. What else we have seen yesterday? What happened to the susceptibility in the disease and what happened of susceptibility in the cure? What happened in the disease?
मैम ससेप्टेबिलिटी डिक्रीजेस।
Yes, susceptibility decreases. How it is decreases? How the signs and symptoms are produced? When that inimical forces acting on the body, we are sufficiently disposed towards that agent and this agent alters our health and this leads to the formation of disease. Clear? And what happen when you
Yes,
administer
ma'am.
our medicine? What happen when you administer homeopathic medicine?
Susceptibility increases.
Yes, when you are giving the medicine to the sick person, that susceptibility will satisfy. And once the susceptibility is satisfied, then this leads to the restoration of the health. Okay. What else we have seen yesterday? Which important thing or which important factor is depend upon the susceptibility? Which factor is depend
मैम
upon
पोटेंसी।
potency, right? Potency and dose. It is
Repetition.
yes, it is depends upon the susceptibility. So only one dose sometimes sufficient to satisfy this susceptibility, and there we have to wait and watch whether that dose is acting properly or not. And what happen in the disease? that to the susceptibility at the beginning of the disease, we are more susceptible. This causes we flow inside the body and this results to the disease. But when we are giving the medicine, that disease flow will not or the influx will not be flow inside our body. The medicine will causes the resistance, the susceptibility will satisfy, and this leads to cure. Clear?
Yes, ma'am.
Which principle is common in cure and contagion?
Susceptibility.
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 Right. Shall we move further? Anyone is having any problem up to this? किसी को कुछ पूछना है, कुछ प्रॉब्लम है यहाँ तक? Say yes or no. Why you are so lazy?
No, ma'am, no problem.
Ma'am.
No, ma'am.
No, ma'am.
Okay, then we will move further. Hence, the Hahnemann writes, medicines.
Ma'am.
Huh?
ससेप्टेबिलिटीवर ना आपण हायर पोटेन्सी किंवा लोअर पोटेन्सी हे सिलेक्ट करू शकतो, पण नेमकी कोणती द्यायची ते कसं कळणार?
आता बघ, काल आपण एक्झाम्पल घेतलं होतं ना, एक डलका माराचं पेशंटचं. आपल्याकडे साधारण 1x 2x आपण फार कमी वापरतो. आपण कसं वापरतो मेडिसिन? 12x 6x वापरू शकतो, 12C वापरतो, 30 वापरतो, 200 वापरतो, 1M वापरतो, 10M वापरतो. 10Mच्या वर फार रेअरली किंवा ज्यांना खूप जास्ती चांगला एक्सपिरियन्स आहे असे फिजिशियन वापरतात. पण आपण काय करू, जनरल यूजमध्ये ज्या पोटेन्सीज असतात किंवा जनरली आपण जे वापरतो त्याचं डिस्कशन करू. बियॉन्ड दॅट जे आहे ते जाऊ द्या. आपण रेग्युलरचं, रुटीनचं बघू आपण. सो व्हेनेवर द पेशंट कम्स, फंक्शनल चेंजेस असतील, अस्थमा आहे, निमोनिया सॉरी कफ अँड कोरायझा, स्टमक डिस्टर्बन्स, हेडेक or the migraine or the increased blood pressure, structural change, sorry, functional changes. I am talking only about the functional changes. In that case, we are giving the medicine on the basis of age. Suppose that lady is of 35 years, that lady is having the dysmenorrhea because of the certain reason, then here you can prefer the 200 or 1m potency because age is not much and there is a functional changes. On the other hand, if the person comes to you same age group, 35 age group, that person is having the deviated nasal septum, that is त्याचा नाकाचा हाड वाढला आहे, and this leads to the breathing problem. So this deviated nasal septum means it is not a functional one, there is a overgrowth. So here we will prefer the medium potency or we will give the 30 potency. सो व्हेनेवर द फंक्शनल चेंजेस के थोड़ा सा ऊपर है यानी स्ट्रक्चरल चेंजेस जहाँ पे आते हैं, देयर वी आर गिविंग द लोअर पोटेंसी or the medium potency, and whenever there are the functional changes we can give the higher potency or we can give the medium potency also. Clear? Clear, Suchita?
हो मॅम. हो.
आणि ना असं काही रूल नाहीये की आता हा पेशंट आहे तर ह्याला आपण 200च देऊ और एव्हरी पेशंट आय विल गिव्ह 1m. नो, दिस इज टोटली बेस्ड ऑन युअर एक्सपिरियन्स. तुम्हाला जसे जसे पेशंट येत जातील ना तसं तसं तुम्हाला कळत जातं की आता 30 पोटेन्सी दिली पाहिजे. जितकी कमी तुम्ही पोटेन्सी द्याल तितकं ते सेल्युलर लेवलवर जाऊन ऍक्ट करणार आहे. ॲज द पोटेन्सी इन्क्रीजेस द द सेल्युलर लेवलवर ऍक्ट करण्याचं तेवढं पॉवर कमी होतो. सो वेन यू आर गिव्हिंग द पोटेन्सी 6x किंवा 12C और वेन एवर यू आर गिव्हिंग द पोटेन्सी बिलो 30, they will act more on the cellular level. As you are doing the dynamization, the dynamic level increases, material quantity decreases. So depending upon the nature of the disease, the seat of the disease, nature of the patient, condition of the patient, age of the patient, constitution, all these factor plays an important role while you are select the potency. Clear?
Yes, ma'am.
अजून काही कोणाला विचारायचं आहे? Anyone? Okay. Huh. So medicine, it depends on very doses according to will appear to have a greater power in affecting the state of health than the natural morbific irritation. The natural diseases are cured and subdued by appropriate medicine. So we have seen this how the medicines are stronger than the disease. They affects the state of health in a more better way than the natural morbific agent. Now, here we might ask the question, when does a medicine that has been administered to cease a homeopathic? जब आप वहाँ पे medicine दे रहे हो patient को, then at what time it will not act as a homeopathic? The same principle is as the susceptibility. If your medicinal power, that is the potency, if it is not matches with the susceptibility, so it will not be helpful for a cure. It will not be a homeopathic medicine because the similarity between the cure and the contagion, हमने देखा है, that is the same principle is applying for the cure and for the contagion. If that potency is not be able to satisfy this susceptibility, then this is of no use, and hence the potency should be matches with that of the susceptibility. Let me illustrate in this way. Suppose we have a case of diphtheria, and after the study the lachesis appears. Diphtheria म्हणजे काय माहिती आहे तुम्हाला? Diphtheria disease, do you know anything about this? Anyone? Say just yes or no. Why you are taking so much time? If you know, then give me the answer. If you don't know, I will give the answer.
Ma'am,
Infection of throat
infection
and
of throat and nose.
What is the causative organism of this diphtheria?
Ma'am, something
Corynebacterium
diphtheria.
diphtheriae.
Diphtheria.
Right. So this is
Corynebacterium.
yes. So this is caused by the bacteria. What are the symptoms in that diphtheria? What are the symptoms? इन्फेक्शन है तो सबसे पहला सिम्टम क्या रहेगा? If the infection is there, then what will be the first symptom?
Fever.
Fever, right? Whenever there is an infection, the first symptom is fever. Then all the symptoms of the nose and throat, because it is an infection of nose, that is, and the throat. So there may be the sore throat, or there may be the cough, or the swelling on the neck. That may be the symptoms of the diphtheria. So after studying the case, what the king has selected the medicine, that is the lachesis. That is a more similar medicine, and the dose is given. He has given a single dose of lachesis. Now when does the lachesis cease to be homeopathic? जब lachesis हमने दी है on the basis of similar symptoms, लेकिन ये lachesis अगर काम नहीं कर रही है, that means it is no more acting as a homeopathic medicine. कब? When the symptoms that indicated is change. अभी हमने देखा कि that person is having a fever, that person is having the cough, then swelling, then the pain in the throat or pain in the ear, then cough is there, general weakness is there, then the sweating is much more. If such symptoms are there in the patient, but the laxacy is not able to cure such symptoms, or it is only decreases the throat pain, but the fever is as it is, the cough is as it is, then this medicine is not acting as a homeopathic medicine, then it is no longer indicated. If the given medicine, if it is not be able to cure that person, that means your selection of the medicine is wrong. If it is given at all after this change, it operates upon a different plane from what it did in its homeopathicity, and it act all it does, not curatively but depressingly. So this laxacies, if it is not able to cure such symptom, so this is not the curative medicine any more than just enough supply. The susceptibility is a surplus and dangerous, so that medicine can be a dangerous one. सो इन दिस वे, अगर आपका कंफ्यूजन है कि मैंने जो लैकेसिस मेडिसिन सिलेक्ट की है तो वो करेक्ट है या नहीं है, तो रिजल्ट मैं हमेशा बोलती हूँ कि पेशेंट इज ऑलवेज अ एग्जाम पेपर टू यू. सो यहाँ पे एक आपको एग्जाम आई थी बैक्टीरियोलॉजी की, पेपर आपके पास बैक्टीरियोलॉजी का था, डिफ्थेरिया बैक्टीरिया आपको लिखना था. आपने उसको लिखा और उसको लैकेसिस मेडिसिन दी, लेकिन आपने जो लिखा है दैट इज इन द फॉर्म ऑफ लैकेसिस, इट इज इनकरेक्ट, or it is partially correct, and hence you will get the less marks, or you will be a fail. As soon as you fail, the patient will comes to you and he will say that, I am not feeling well, my fever is not decreased, only the pain slightly decreased, the cough is there, the swelling is as it is. That means your selection of medicine is not proper. Clear? Clear?
Yes, ma'am.
Yes, ma'am.
So this medicine is no longer acting as a homeopathic medicine, that is a similar medicine. You have to find out the new best selected similar medicine. The second example he has given, in a case of chronic disease administered sulfur, when it is clearly indicated, whenever you are using the polycase remedies such as lacasis, sulfur, phosphorus, silesia, हमने ये फार्मेसी में भी पढ़ा है कि सिलेशिया, phosphorus, we are not giving in a pre-tubercular condition, or we are not giving after the tuberculosis. If that patient is having the recent history of tuberculosis, we are not giving silesia and phosphorus and lacasis. याद है आपको? याद है हमने ये पढ़ा था पोसोलॉजी में. Why you are taking so much time? Nobody is here. Nobody is here. Hello.
No, ma'am, we are there, ma'am.
I think you are switching on the mobile and you are reading anatomy and physiology. I think so. Is it the case?
No, ma'am.
And why you are not answering? Nobody is answering. Just I am asking yes or no. I know you are having the burden of first year. Just 2 days are left. Today and tomorrow. Afterward, there will be a no lecture of second year. And hardly 1 or 2 or 3 lectures are there. First is anatomy, second is of organ. And after that, you are not having any lecture. Correct? And in the afternoon only you are having FMT and pathology. In between that, you can learn your anatomy and physiology, and you get the 6 months to study the first year. Why you are behaving like this? 6 महीने मिले हैं ना आपको, फ्रॉम अप्रैल टू नवंबर. तब क्या किया आप लोगों ने? And now you are saying कि so much less participants in the meeting, only 18 participants out of 72. So 6 महीने आपने गवा दी ऐसी, and now you are reading again the first year. अब वो याद नहीं आ रहा होगा. Is this a case? अरे give me the some answer. Please. Otherwise, I will not take, I will end this meeting here. You go and read your anatomy and physiology and pharmacy. Just give the answer.
Yes, ma'am.
What happened?
Nothing, ma'am. We are studying.
Ah, you are studying that, I know, but why you are not attending the lecture properly? Only 2 days are left. After that, you will get again the time to read your. And what I am saying is, 6 month आपने किया क्या? हाँ, 6 महीने किया क्या आपने? झेलना, गीतांजलि, क्या किया हम लोगों ने? निकिता, सौम्या, nobody is answering. युक्ता, तेजश्री,
Yes, ma'am.
बोला
Yes,
काहीतरी.
Yes, ma'am.
बोलो क्या? Yes, ma'am. What you have done in the last 6 months? From April to October, what you have done? घर में ही थे ना आप लोग?
Yes,
हाँ?
ma'am.
फिर
ma'am.
तब क्या किया? एग्जाम एग्जाम नहीं है इसमें रहे. हाँ तेजश्री,
No, ma'am.
मग अचानक आता इतकं बर्डन का आलंय फर्स्ट इयरचं? भाग्यश्री,
यस मॅम.
झाला की नाही अभ्यास फर्स्ट इयरचा?
मॅम झालाय पण रिव्हिजन वगैरे सुरू आहे तर मग याच्यामध्ये जास्त लक्ष नाही देऊ म्हणजे
हो ना.
दिलं तरी पण नाही जात आहे ते थोडंफार डायवर्टच होत आहे.
पण आता 2च दिवस उरले आहेत ना, आज आणि उद्या.
यस यस मॅम.
मग ते तेवढं तर बेअर करणं आवश्यक आहे. आणि तुम्हाला आधी भरपूर वेळ मिळालाय.
यस मॅम.
जर तुमचं राईट टाइमवर एक्झाम झाली असती म्हणजे तुम्ही त्या भ्रमात राहिले वाटतं परीक्षा नाहीये म्हणून. निकिता?
Ma'am.
हं. ओके. लेट इट बी. नुसतं ऐका, कानावरून जाऊ द्या, डोक्यात नका जाऊ देऊ. चालेल आहे. फक्त आज आणि उद्याच आपल्याला सगळे लेक्चर्स बेअर करायचे आहेत. आणि हे पण तुम्हाला तुमचे आन्सर्स लिहिताना कामात येणार आहे. Okay. So in case of in chronic case, administer sulfur when it is clearly indicated. The symptom disappear and the patient feels better. But on the other hand, when the medicine is clearly indicated, when it's similar to the case, that medicine will cure the patient. Then the remedy ceases to be a homeopathy and it is administered longer, whether its action has is neither homeopathic nor desirable. So in the first case that we have seen in the lachesis, when that medicine is no longer acting as a homeopathic medicine, stop that medicine. It is not desirable to give the medicine again and again. But man argues if a little will do good, more will do more good. But what we are saying कि if we are doing थोड़ा सा उसने काम किया है मेडिसिन ने, अगर हमने ज्यादा दिया तो वो ज्यादा अच्छे से काम करेगी. But this should not be uh, practically applied in our case, because if that medicine is not similar, so it will not good anything. It will not give you desirable result, but it will give the dangerous effect. Enough to effect a change is that can be a homeopathic when a certain changes are effected, then the physician must wait. लेकिन वो 5 में से 3 symptoms उसने cover किए हैं, then it is a well selected remedy. Here the physician can wait, but if that remedy is not able to cure a single symptom, then that means we have to stop that medicine. Enough medicine must be given to establish order, and that is given almost instantaneously. As soon as you have so what is how to decide whether that medicine is correct or not, whether that medicine should we continue or not. So this is the right way कि that medicine will give you the result after the some period at most, और इंस्टेंटेनियसली आपको वहाँ पे रिजल्ट मिलेगा. एट मोस्ट इट इज़ बट अ मैटर ऑफ फ्यू आवर्स, एंड एज लॉन्ग एज ऑर्डर कंटिन्यू आफ्टर वंस इट हैज़ बिगेन सो लॉन्ग हैंड्स ऑफ. तो आइदर आपको जल्दी रिजल्ट मिलेगा या आपको कुछ घंटों में रिजल्ट मिलेगा. एज सुन एज द पेशेंट फील्स बेटर, हैंड्स ऑफ, यानी वहाँ पे ना आपको डोज रिपीट करना है ना आपको मेडिसिन दूसरी देनी है. सो दिस इज़ द राइट वे हाउ टू जज योर मेडिसिन, whether you have whether your indicated medicine is suitable for the patient or not. अगर आपने मेडिसिन सिमिलर दी है, so that will act instantaneously or within a few minutes or hours. लेकिन बहुत टाइम हो गया लेकिन पेशेंट को कुछ भी रिलीफ नहीं है, दैट मीन्स यूर सिलेक्टेड मेडिसिन इज रॉन्ग. लेकिन कुछ टाइम के बाद अगर मेडिसिन आपको रिजल्ट दे रही है, द पेशेंट फीलिंग बेटर, दैट मीन्स यू हैव टू स्टॉप देयर. आपको डोज भी स्टॉप करना है. एट द सेम टाइम यू हैव टू यू विल नॉट बी वरी, आपको मेडिसिन भी वहाँ पे चेंज करने की ज़रूरत नहीं है. दैट इज़ जस्ट द वे ऑफ contagion टेक्स प्लेस. इन डिप्थेरिया द डिसीज बिगिंस, ससेप्टिबिलिटी सीजेस. अभी हमने जो कल देखा था कि हाउ द डिसीज प्रोड्यूस, तो वहाँ पे हमने इनिमिकल एजेंट लिया था. तो यहाँ पे इनिमिकल एजेंट कौन सा है, दैट इज द डिप्थेरिया. दैट विल एक्ट बिकॉज योर इम्यूनिटी इज लो. वहाँ पे ससेप्टिबिलिटी सीजेस, अ चेंजेस टेक्स प्लेस that protects the man from further disease cause flowing into the body. अब ये जो disease cause है, it is flowing inside the body and the disease develop, and this disease will develop itself in the form of symptoms. So because of the certain reason, when your susceptibility ceases, this bacteria will act on your body, that infection will flow inside the body and this will develop and this will manifest in the form of signs and symptoms. Now here there is a role of physician. That physician will give the potentized medicine, he will give the proper dose, and then there will be the repetition of the dose according to the condition and of the patient and the condition of the disease, and you will get a proper result. It is true that in vigorous robust subject who have lightning line reaction, the dose may be repeated and changes occur for the better if the remedy is not quite homeopathic to the case. Robust constitution है यानी patient की immunity अच्छी है, so he will give you the instantaneous reaction of the suitable remedy that you have given. लेकिन अगर रेमेडी आपकी रॉन्ग है, if the remedy is not quite homeopathic, then the changes will occur that will again give the instantaneous result. But some are injured in this way because they are delicate. अब robust के opposite क्या हो गया, delicate subjects कि whose reaction is very slow. The reaction is actually prevented by the repetition of the doses. That is, the order we have tried to establish is actually prevented. So जैसे instantaneous reaction आपको robust constitution में, vigorous constitution में मिलेगी, यानी अगर मेडिसिन सही है, so the result will be जल्दी मिलेगा, और मेडिसिन गलत है वो भी रिजल्ट आपको जल्दी मिलेगा. लेकिन जहाँ पे पेशेंट इज़ वेरी डेलिकेट, द इम्यूनिटी उसकी बहुत ही लो है, दैट इज स्लो इन रिएक्शन है, तो वहाँ पे दोनों कंडीशन में आपको रिएक्शन सही है या गलत है इसके लिए इट विल टेक सम टाइम. Anyone teaches that the human economy is more under the control of man than under the control of disease. अगर आपकी immunity अच्छी है, so that person will give the better result as compared to the delicate subject. And that susceptibility, that human economy is in our control as compared to the disease. For the economy can be affected only as such disease as it's susceptible. So when the disease will act or the economy is affected by the disease, when you are susceptible, when your susceptibility decreases, then only the disease will got the opportunity to act on our body, whether for the purpose of proving or the purpose of curing. So we have to take a proper nutritious diet to maintain our susceptibility, to maintain our immunity. If your immunity decreases, then the disease will act on your body. सो दिस ससेप्टिबिलिटी इज इम्पॉर्टेंट कि आप उसको कैसे मेंटेन रखते हो, हाउ यू आर मेंटेनिंग योर इंटरनल इकोनॉमी. The proving may be this susceptibility is important, and during the cure also this susceptibility is important. So by giving the above example, he clearly mentioned that if you are having the vigorous and a robust susceptibility, the reaction will be fast, the patient will cure in a better way, and during the proving also, that prover will give the all the symptoms of that particular remedy. But on the other hand, where that person is delicate, who is not taking a proper diet, proper regime, proper exercise, so in both the condition, that is in the proving and in the cure, he will not give a proper reaction. Proving में हमको बहुत कम symptoms मिलेंगे, और curing में भी he will give a lot of days to be cured. Can also vary the dose, that he can always gets a result, and they are very susceptible once terribly damaged by the repetition of the dose. So repetition of dose भी आपको differ करना पड़ेगा depending upon the susceptibility. Robust constitution है तो repetition कम लगेगा, delicate है so you will require the repeat dose. In the 31st paragraph, Hahnemann says that disease cause are limited in their ability to effect the changes in health to certain condition and states, that is to susceptibility. So these changes that are occur inside our body, that all things are depend upon the susceptibility. During the proving, the susceptibility is important. In the contagion also this is important. In the cure also this is important. This is all the Hahnemann says of doctrine of cessation of cause after the certain evolution taking place. So when you are giving the medicine, the flow will stop flowing inside the flow, that influx will stop flowing inside your body. But again, this is depend upon the susceptibility. We see that when a natural disease is taken, it's run its period, it tends to decline, and the patient will be not susceptible until another change of state has arrived. So जब natural disease होता है, so it will take the position, यानी वो symptoms आएंगे, it will run its course and then it is decreases, यानी वो ऐसे spike बनाएगा. There is a beginning of the natural disease, it will develop the symptoms, the symptoms will increases, as soon as you give the medicine uska resistance usko milega, and then it will start decreases. So this thing is again depend upon your response, your reaction ki patient kaise react karta hai. We see that when a natural disease is taken its period, it tend to decline and the patient will not be susceptible. It is true that when man will go from one state of susceptibility to a disease, and in a few days go to the another state of susceptibility, that is of the same disease. So once the when the susceptibility is decreases, that is you will get the disease. But as soon as you took the medicine, the susceptibility again increases. There must be a change, a cycle, which means a certain length of time. So but ये जो थोड़ा टाइम लगेगा डिक्रीज से इंक्रीज होने में, in that period we have to take a proper dose of medicine. So proper administration of medicine is important here, and the time of administration of medicine is again important here. So जब disease होगा, so it will increase and then it will start decreasing. लेकिन जो increase होने में और decrease होने में क्यों हो रहा है? Because of this proper administration of the medicine. It is commonly the appearance. The medicine act all the time. अब medicine ये क्यों कम कर रही है disease? Because we know it all the time वो act करती है. It should be clear in your mind that this is only the appearance. So the medicine एक बार आपने दे दी उसको, so it will acting on the patient's body and you will get it from the appearance of the patient. It really means that a certain length of time elapses before another dose is necessary, that is another state of susceptibility has arrived. एक बार medicine आपने patient को दे दी, if the patient feels better, that means now the susceptibility is increase, यानी state of susceptibility is change here. जो पहले decrease थी, now it is increase. So again we say, whenever medicine ceases to be a homeopathic, it is no use to administer that medicine any longer. as it will act on the patient only upon the artificial susceptibility. So if your medicine is of no use, अगर वो similar नहीं है तो उसको वहीं पे हमको बंद करना है, because it will not produce the artificial susceptibility that we require. By this, we mean that a certain sensitive patient always have the susceptibility to high potency. That is, idiosyncratic patient we have seen in the drug proving. The meeting will over within the few seconds. Rejoin only for 15 minutes. So we have seen that the sensitive patients are there whose the susceptibility is high, and here we are using the higher potencies. We have thus two things we deal: acute state created by the disease itself, and a chronic state, which is the natural state of the patient born under the miasm. So in the acute state what happen, the patient satisfy the patient के जो susceptibility है, it is satisfied very easily in the contagion, because the period of time of the disease is not much more, it is very less time. influx जो है disease का, it is very less. The immune system जो है आपकी